medicine in Madras Medical College in 1993. He has worked as a faculty in paramedical institutions and as a psychiatrist in various corporate and charitable organizations. He has also done community health programs in Chennai. His research interests include issues of health, environment, and socio-economic conditions of laborers. He is also deeply interested in developing multifaceted volunteerism among youth and creating integrated collectives of young people working on various domains. Dr. Anbu believes in evolving empowered communities that live simply and sustainably with health, happiness, peace, and prosperity. I think I still would have understated Dr. Anbu's achievements, even though I have listed out what I could. His appeal is tremendous in for all ages. So, well, without further ado, uh, over to you, Anbu sir. You're on mute, sir.
Oh, okay. Yeah. Yeah. So good evening, all, and Ganesh. Two double thanks. One for inviting me, and then saying all those nice words. It's very aspirational. That's what I would like to be. But yeah, well on the way. Hopefully, at least in that direction. So yeah. So today's topic. Um, uh, so. Um, it's a very old issue actually, and unfortunately, it's still very much present even today. So it reminds me of this book by one of my friends, Dr. Thomas Tynan, himself a psychologist. This book, uh, nothing old, nothing new. So Stigma, I think, would fit that book. No, in fact, in that book, he deals with psychiatric experiences, lived experiences, and it's pretty very succinct. That book, it's a short thing. So yeah, so Stigma. So it's been there since very ancient times, and it is there now, and it is going to be there for a long time to come, unless we really set to it and do something very serious about it. Okay, so let's start with the Ganesh Stuti இருக்கும் இல்லையா, Ganesh Vandanam பண்ற மாதிரி. I have some, since I have my community medicine background apart from psychiatry, so I always start with this thing. So how many people do you see here in my frame? In my frame, how many people do you see? People can either reply on the chat box in words or in figures, or you can use the audio, no problem. Let me also request all of you, so if we can, although Ganesh told me that we can present it for a half an hour or something like that, or 40 minutes, and then have a discussion. But I would actually like to kind of co-create it, so we have a sort of ongoing conversation about this, because stigma, is not something that just professionals can handle or remove. Of course, they have an important role to play, but there's a huge role for all kinds of professionals and non-health professionals, whether mental health or physical health. But all of us, people who are not professionals, ordinary people, community members, every age, everybody, because so it concerns all of us. Like they say, it takes a village to bring up a child. It takes a village to create stigma and the consequences, and it takes a village to remove it and heal and all that. So therefore, I would like all of us to kind of feel free to interact and co-create this session. But I will try to sort of catalyze or initiate and set some basic ball rolling, the conversational ball rolling. So stigma, sorry, before stigma, this question of mine. So people, please feel free to interact either on the chat box or in audio. You just have to unmute and speak something, and then people take that into account. Maybe Ganesh can keep looking at the chat box. If you find any questions or anything, you can pop it up, and then I can take it as we go along. Yeah. So this very basic question: how many people do you see in this frame?
I wouldn't do that. I can't do it. That would be cheating. I have a count here.
You have a count. What?
I was just saying I have a count here. It's one on the screen. We have only 1, 2, 3, 4, about 9.
No, I'm talking of my screen.
Meaning, on your screen. You're
Just
sharing
look very carefully and count very carefully and tell me.
One only.
Everybody?
Yeah, where your face is, there is only one. Other than that, there are 69. Oh, sorry, 79.
One. It's got 1, 2. We have people saying 2. We have people saying 6. We have people saying.
No, my question was on my screen, not on the combined screen. On my screen, how many people do you see? Yeah, in this screen.
80.
Huh?
80.
80?
Yeah, besides you.
Doctor, I would say you and every other person that you've interacted with all these years.
Oh my God, that is so deep.
Suresh Vengarkar has raised his hand.
I just wanted to check whether that's possible. I'll lower it.
Actually, I'm traveling, but okay, I can say in the car, how many people do you see?
Just one.
Just one, all clear?
Just you.
Okay.
So we heard the driver, so I don't know whether that counts.
No, but have you seen the driver?
No. We just
No.
heard. That's good.
Yeah. You heard the driver?
Or somebody else. We heard somebody else in the car.
No, that's the traffic. That's just the traffic. Okay. There is a driver because I'm not in an automatic car or anything. So there is actually a driver. But then you're not seeing him. On the screen, you're seeing just me, right?
Yep.
Yeah. But I am going to say that what you're seeing is, you need to see more clearly. There are actually 3 people. It's like an aura thing. I want you to practice your auric vision, like that, whatever you do. Can you kind of see a haze or an aura or another doppelganger sort of thing?
There are different kind of filters as you're traveling in the traffic. There are filters.
We're not talking. No. We're talking of a human.
Okay, Pallavi Gambhir says no. There.
Okay, so enough of the Ganesh Stuti, as I was saying. So when I say 3 here, I actually mean 3 bodies, which are all me, but different aspects of me, right? So one is my physical body, correct? Because that is what you're actually seeing. But what are the other 2 bodies that you would say, which travel along with me, inside me, or around me, or which I'm composed of those. What are the other 2 bodies? Physical body, all of us can see. We can touch. We can. Yeah.
Mental and emotional.
Great. Mental, emotional, I'll put in one box. saying that is a psychological body. Whatever goes into it. Spirit also I'll put into the psychological body. In fact, like we say, in psyche, the word psyche, from which psychology, the study of psyche comes, it means butterfly. So the mind flits around. So the soul, spirit, and mind and emotion, everything comes into the psychological body, right? Okay. So 2 bodies accounted for, but there's one more body to be accounted for.
Aura.
Third,
Aura.
sorry?
Aura.
Aura. Okay. So I'm not going to go into aura because I can only go into things which I can handle, right? So since I'm not a pranic healer, I'm not going to go into aura. But aura also you can probably.
That's energy.
Sorry, yeah, energy body.
Yeah.
But I suppose you can put it into. Sorry.
Third body is the body that has been created by the image people have about you, that has been made by other people.
We have a couple of entry: physical, psychological, social, and ego, superego, like that, and eighth, ego, superego, and mind, internal, external, social, demographic. Those are the comments in the box, chat box.
Okay, good. I will go with what you said about all the social things that you've come, what other people see of you. But rather here, we are not looking at what other people might see something of me, of my social aspects, but it's more of what consists of me, within me as a social body. That sounds a little Nityananda, no? Within me and all that. But yeah.
So the conscious and the unconscious, sir?
Yeah, you can say all that. But here, that will again go into psychological body, right? Conscious, unconscious will go into psychological body. So the third body, which without much ado, is the social body. But not the social body exactly that people see, but the social body that I am, that I know for the most part. So it starts with my name, Anbu, as you said, right? Or my age, my gender, my sex, my sexuality, my education, my job, my marital status, my language, or the languages, my social status, the region where I come from. So if you want the race and the caste, community, so all this as a composite is my social body. And in that social body, there are like aspirational aspects also, right? I would like to be this, I would like to be that. And all this is my social calling card, right? Why I'm putting so much emphasis on this is that we have to look at the human. Can other people sort of mute themselves because noises are coming? Because I'm already traveling and it's a little noisy. Sorry about that. But
Sureshji, can you mute yourself? Because there are disturbances from your side.
Sureshji?
Unless, of course, you want to say something, then by all means you can open and speak.
Suresh Vengankarji, can you mute yourself?
That was good. Yeah, 1 minute. I'm sorry. 1 minute.
So, I'm making a big fuss about these three things to make it clear and kind of reiterate it and from a very professional perspective, from a community medicine perspective, from a world well-being kind of perspective, I am emphasizing that when we see one person in the screen, we are missing out the other two components. So that is how, of course, we know someone's psychology when you look at the face being the index of the mind, and by their clothes and by their position, we know a lot of things. But I'm saying being really present to it at all times, because today's topic has a lot going on in connection with these three bodies, right? So We have a physical body, we have a psychological body, and a social body. Of course, they are intermingled, they travel together, but I do need to tell you that they are not one and the same. They are not always aligned together. For example, my body is right now, encased in a car, but my spirit wants to stand up and run around and be much more free, right? So that's my spirit, and socially there is some other expectation. So there is always this conflict. So it's like the Buddha says, there is no absolute one, which we know. One is just an approximation. In reality, it is 0.9999, and it goes on like that, right? So it's composed of so many 0.0011 and all that. You add all that, then you get one. So one is not just one, although we say one, right? So there is nothing one. There is no one in this world. Everything is composed and connected. So this is the premise on which I want to open out this discussion, right? So people are okay with this, that we are not just one, so in a way, when you're being faithful to your lover, whether wife or husband or boyfriend, girlfriend, whatever it is, you have to love all three people. So there is, in a way, it's not a monogamous relationship. You have to have three people. Many people are happy. Oh, I'll have three people for the price of one. No, you get one, you get two for the price of one and all that. You get three for the price of one. So we need to get this very clear that these three are not always aligned. They're not always cooperating with each other, right? For example, this girl is not for you. Maybe you're too old for her. Maybe your community is wrong. Maybe your social status is wrong. Especially the girl as an individual doesn't dig into you. She doesn't want you. And even you know all that, right? But your socially, you know that your social body tells you that no, that girl is not giving me any message, any kind of vibe. I know my aukathi kya hai and all that, but your mind will not let go. I can hope. I should never let go. I should keep hoping. I should keep trying. Something like that. And or a person ditches you. You can't just okay, that person left me. No, you are troubled. You are depressed. You are yearning, languishing. Right? Sometimes the effect of this psychological craving will even lead to either social malfunctioning or physical either ailment or destruction, like suicide or self-harm, all that. So this is the premise on which I want to start. This is not only about stigma, this is about everything in a human society, that we are not absolute one. We are composed of so many things. In fact, these three is an approximation and an easy thing, like Sir was talking about aura and all that. Yeah, that also we can work on it. But we are talking of a practical thing. Ordinary human beings, not trained in anything. We are not even talking of professionals or anything. Anybody as a human being, we have to be aware of these three things. Yeah, if you can learn about aura and you can learn about other spirit and stuff like that, then good for you. But many may not have the opportunity to learn it or the skill to learn it, or maybe it's not even real, we don't know. But these three, the physical body, the psychological body, and the social body, is something we will have to be present to, both within us and within everybody else that we interact with, whether it's family, whether it's friends, whether it's colleagues, whether it's clients, whether it's even a general co-passenger. For example, I'm with the driver, right? Imagine if it was my brother or sister, I would not be able to talk loudly like this. There is Anbu, don't you have anything? How are you? You're disturbing us. If you had to do all this, why did you have to? There'll be a different thing. But because of my privilege as a passenger, and where he's professionally driving, so poor guy, he has to put up with my loud noise, right? So his social body has to accept what my physical body is putting out and accept, right? So this is where it is. Of course, my psychological sensitivity might try and not make it too harsh for him, or maybe I get his permission and I apologize to him. தப்பா நினைச்சிட்டாதீங்க, இது இப்படி ஆயிடுச்சு, டைமிங் இந்த மாதிரி ஆயிடுச்சு, நான் வீட்டுக்கு போய் சேர்ந்துருவேன் நினைச்சேன், பட் டிலே ஆயிடுச்சு, அதனால யூனோ இந்த ப்ரோக்ராம் இங்க பண்ண வேண்டிய whatever. So we need to be aware of this very complex interaction and dynamics between these people. Those who have done transaction analysis, you know that. Like among all the psychotherapeutic methodologies and traditions, I think transaction analysis is very much here and now and very conscious and very social. It talks of your parental and adult and child ego states. So yeah, this is the thing. So now stigma. So let's get some trivia away out of the way, right? Let's ask people. So what do you know about stigma? What comes to your mind when we say stigma? Have you heard this word? Have you experienced this word? Do you have any idea, concept, definition, whatever?
A large number of
For me, being isolated and not being able to come out, keeping the skeletons in the closet, so to speak, because of what may happen if we let them out. Pallavi has her hand raised. I'm sorry.
Yeah, go ahead. You're free to. Yeah.
Hiding your mental illness when we have to speak a truth.
Okay. Anybody else? Rama?
Sir, wrong thoughts about people that does not help you to come out. Wrong thoughts or wrong belief.
community perspective about something which is not liked and they
Did not help you to come out and you find it difficult.
Okay. Okay. Anybody else?
Black mark. Gopi here, black mark or devaluing something, giving it a negative value, negative association.
Yeah. Generally, though the mark may be of any color, but the way we metaphorize it as black mark.
Correct.
Black mark. So that itself is stigmatizing. Yeah. So stigma ke stigma கொடுக்கிறோம்.
Stigma, we give it via stigma. So we use a inappropriate term, I guess.
Yeah.
Hello.
Unacceptable.
Okay.
Can I say?
Something that is forbidden.
Not exactly forbidden. Yeah, but something which is not acceptable, sort of. Yeah.
Yeah. Can I say?
Yes, Suresh.
No. See, this is something only stigma cannot be connected with only mental health, first of all. Right? There is another thing that comes as a rational and irrational. Again, that comes to your viewpoint and others' viewpoints. How you look from the way you see the things, others may not see in that. Right?
Yeah, there is a difference of perception.
In addition to that, there is something like looking good and good looking. There are many things, many things, not only one thing. There are many things. If I want telling, there are many. So,
okay.
Thank you.
Sure.
So stigma is extreme dislike for things that are concerning you.
Yeah. So all of this is there, but okay, let me put it since kind of somebody else wants to say. Go ahead.
Yeah, I
लोग क्या कहेंगे?
Stigma is something which is considered bad as per the social norms, and it sorts of makes us inhibited. We don't want to show even if we are undergoing something because it is considered bad by the society.
Yeah.
I think I have to define stigma. I would say it is the belief system in response to societal expectations that are generally tabooed. It can be social in nature, it can be internalized, it can be perceived, it can be self stigma. It's just a belief system of a person.
Yeah.
When we disclose our mental illness, perception of the society, people change and it harm us.
They harbor a negative attitude.
A social disapproval, sir.
Yeah, could be.
Could it be negative branding?
Yeah, that too. Sheila wants to say something.
Yes, doctor. As ma'am just mentioned, it's branding, stickering, or labeling of anything with a negative
Labeling. Yeah.
negative connotation.
Okay. Money wants to say something. Manish, I think. Manish has raised his hands.
Manisha ma'am, you have your hand raised.
What fear of not being accepted?
I have already spoken. Sorry,
I'll lower your hand.
What fear of not being accepted in society?
Okay.
Couple of other posts in the chat box. Behavior not accepted by society, which is something related to what we were talking about.
Okay.
And of course, the stereotyping is another thing which has been highlighted. And labeling, for example, we have one post which says neurodivergent people are labeled all the time.
Yeah.
See, I will say.
You want to say something?
Last thing only I will say.
You are.
Somebody is different from the masses.
Sorry?
Somebody, his behavior, his acts are different from the masses.
Okay.
Not
Okay.
So that is a place where he is being noticed as a, they call it, I don't want to use that word, but for him he is proper. For him, he is behaving the way he wants. Okay.
What is the word that you don't want to use?
Mad.
Okay. Actually, nowadays, the way we look at words is a little, at least people can, of course, say whatever, but they can share and there can be different perceptions. But nowadays, any so-called negative words, we own them, we take them, and we express it freely. So, for example, if I'm mad, I openly say I'm mad. Okay. For example, if somebody is disabled, we try to make a euphemism and say differently abled or divyang or something like that. But if you ask many differently abled people or people who have some disability, they say just call me disabled, and but don't make it difficult for me. If you can make things easy for me, do it. But just calling it by another name. So we have something called mad pride. There's a whole movement. Of course, you might have heard about gay pride, right? Where gays were stigmatized and then they got into gay pride. So they owned the word. Instead of being shamed by the word, they owned the word and they created a pride march and all that. So likewise, even mad, the word mad, again, it's the intention with which you're doing and the kind of behavior that follows. Okay. So mad is not a bad word as such, but it's the context and the way you use it that makes a difference. So Aditya wants to say something, I think.
Deshpande ji, please go on.
Regarding stigma, I want to say that it is the thing which make us uncomfortable.
Okay. Yeah, cool. Anything else? Okay, now let's go ahead with some little trivia about stigma. So the word stigma, in my life, I first heard it in my biology class. Do you all remember? In biology, inside the flower, right? After the the stamen and the sepals and petals, inside the thing, where in Tamil we say magarandam, right? Where the pollen and all is there. So there you have something called a stigma. Stigma is something on which when the honeybee or butterfly sits, the pollen grain gets transferred and pollination happens. So we can start from that. Stigma as a very word has stigma. Plus it sticks. It sticks, right? Now, what is the other stigma that I heard next was stigmata. I used to read a lot of storybooks and random readings here and there, and I found out there is something called the stigmata. Stigmata is the 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 scars or the wounds that the Christ bore because he was crucified, he was nailed to the cross. So every place where they hit a nail, he bore those stigmata, that is those injuries. Now there are a lot of people, they say, devout Christians or maybe not even Christians, but they have similar stigmata, such marks on their body, right? The church itself doesn't give too much importance to it, but it's a kind of reminder and it's a kind of that in a way which you are connected with the church or Christ and all that. So stigmata is the mark that you bear. Okay. Also, as a child, I remember reading in an easy version. I read Three Musketeers, and in Three Musketeers, if some of you have read it, there is these inseparables. Okay, the Three Musketeers are inseparable, and I think one of them, if I'm not mistaken, is Porthos, or I don't know how you pronounce it in French. Porthos has a mark on his shoulder, the fleur de lis, that is the lily flower. So that is a brand. Someone, I think Sheila, someone was saying the branding that happened when you are punished in the jail. Okay, they put a brand so that even when you come out, that brand will be there. You even if you forget, that brand will be there. So then, according to I don't know if I'm spoiling it, but later on, a very important character in the story also a lady character, let me say, has that, and that person has been covering it up with jewels, with dress and everything, but it comes up. So this is stigma. Stigma is something that you like. So you're a criminal. So you've done a crime. You've been proved and you've been put in the jail. But so that you should not forget it, and so that the society should also know that who you are, they stigmatize you and give you a permanent branding on your shoulder. In the French context, it was a lily-like thing, so that was the stigma. So stigma has all these origins, and as we said, there are these three aspects that we should be aware of. That is the physical aspect, the psychological aspect, and the social aspect. So as everybody said, stigma is something that is negative, right? There's a branding, there's a labeling, there is a way in which you differentiate that person as having something which is undesirable, right? This much is clear. But what we have to know is there is a different aspect as far as stigma is concerned. There's something somewhat related to it that is called prejudice. Okay, so prejudice is where the problem may not be so severe, but it's your perception, right? you have a negative perception, and so you might ill-treat a person or you might judge the person wrongly. But stigma is often due to some situation, some real situation, which is not so subjective. So there is a situation which sets you apart. Either it's a brand, or it's a scar, or it's a disease, whether physical disease or mental disease, or a social situation. For example, in Indian context, it might be being a low caste, or a Dalit, or a tribal, right? Or also complexion. If you're dark, you're dusky, even brown for some people is bad, right? So these are things which are really there, right? It's not something imagined or something judgmental alone. There is a fact, there is something that is different, but that stigma is being looked at as a stigma, not just as a different characteristic, but as a value judgment that is something that they are bearing, which is either a sin or something which is terrible or something that should not be allowed into common society and stuff like that. And this stigma, which is bordering on the green wavelength. So that stigma, which is also fuzzily connected with prejudice, when it moves into action, into behavior, that is where the problem really comes up, where you discriminate and uh, create consequences for the person who bears those stigma. The stigma could be anything. They could be short, like you call them a dwarf, and you create, like in Tamil, what would you say? You'd say, Chitrakulla, Japan Kulla, Kallana nambana kuda Kullana nambakudadu. So you are stigmatizing a physical attribute which he bears. It's true, it's not imagined. He is short, and he is shorter than the average that is expected. But you have stigmatized it into a negative brand, and you are attributing a lot of things to it, and then you differentiate. You will not get married to him, you will not be friends with him, you will not engage him for jobs, or you will put him as a circus clown, not for anything else. It's okay if he wants to be a clown, that's different, but if he's forced to only be a clown and nothing else, just because of the height, right? So, and it can be positive. For example, if someone is tall, automatically they'll be put into the basketball thing. So sometimes it can even be positive. But again, it is forced. It is by someone else judging and forcing you to be something else. So, like Suresh was saying, oh, I'm a little hesitant to use the word mad. Yes, we should be hesitant to use it as usual, where we say, we pejoratively use it, or denigrate someone, or swear at someone using that word. No, but as a condition, or especially on yourself, oh God, I'm feeling so mad, I just can't handle it, I feel bad or I feel sad. These are genuine distress and genuine condition. So a condition which is there, it may be a physical condition, it may be a mental condition, it may be a social situation, but if you have made the condition into some kind of contamination or some kind of labeling which is negative, and that leads to discriminating or differentiating or ostracizing behavior. So in the past, for the most part, it was physical ailments. If you see the biblical movies, Ben-Hur and all that, Ben-Hur's own mother and sister are afflicted with leprosy, right? And I was reading it in a book, in an extract. When Ben-Hur comes near them, they know it is Ben-Hur, that their boy, their son, or their brother, but he can't, because their face is disfigured and all that. So when he comes to, in a healing way, when he comes near them, they're afraid that it will contaminate him, right? And they say, unclean, unclean, be away and stuff like that. But he, of course, become a different person. So he comes and then they are healed and all that happens. So in the ancient times, it was more physical. This particular Tamil proverb or Tamil Paramuri or whatever I told you must have happened many centuries ago, right? When physical things were discriminated, right? Were stigmatized. Even a thing like left hand, you know, look at the words, right? Uh, what is the word for being very skilled? If someone is very skilled, what is the word you use? Can anybody supply?
Dexterous.
Dexterous, exactly. Or adroit. Now, dexter in Latin means right-handed, right. Okay? And adroit in French means right. So that means what is left is bad, right? If you're dexterous, being right-handed, if you're adroit, if you're right-handed, then being left-handed is the opposite, right? So what are the words? So you say sinister or gouache. You say, oh, he's so gouache. We also say that, oh, he's dressed in such a gouache way. But what is gouache? Means left-handed. Though now the origin of that word has been lost or forgotten or hidden, it means this. So it goes in all parts of your body, right? I don't care a damn. I don't care my left foot. Left. I know my left foot. That means like not to care about someone, even my boot is or my foot and so on. By my left foot now you're making it even more. So these are the kind of so initially the past was much more about physical kind of scarring or physical kind of differences, physical kind of ailments, especially very contaminating, very sometimes also like the plague, right? Dangerously contaminating and infectious, and things which they didn't understand. Towards the more medieval periods, it became more psychological, and that is still continuing. Of course, not that physical stigma has disappeared, but to a great extent today we are able to handle, right? For example, gender-wise, now we are working towards more equal, egalitarian thing, and people can change their gender, right? From male to assign female to a female in the left, the left, to assigned the female at birth to female, from assigned male at birth to female, all those kind of combinations. So we are working towards that, but it is this. There are two things I think we should be very two or three things. First is that we have to know this compositeness of stigmata, of stigma, the compositeness of our own self, right? So we have to be aware of our own body, which is composite. That is one thing. And two, we have to give the individual the freedom, right? The autonomy to decide whatever, how the person wants to call themselves, how they want to express themselves. And thirdly, we need to support as professionals, as society, and all that. Yeah. So in the past, it was much more, I would say, physical things. In the medieval times, it was much more psychological. Now, and also social, but now I would say in the future, it will be much more aspirational in Munadi people. And we can already see that, for example, people are committing suicide because they could not get a medical seat, right? Their aspirations didn't come. Or I have known people who are depressed or attempting suicide because they did not get enough likes, or they did not get on their Facebook, right? Or they were not wished at 12 o'clock. You know, all these things which have internalized and self-stigmatized, right? Or based on their sexuality, they can stigmatize themselves. So what we call as, you have introjected the external social value judgments into your own self, and you thank you. You've stigmatized yourself, and you have isolated yourself, and you reduce your social interactions, etc. So so the so you have, for example, at the social level, okay, you have a widow, especially in Indian context, especially probably in a Tamil context. So till recently, and even now, very discreetly, of course, in those days it was horrendously done, but nowadays more discreetly, maybe a woman will not wear kumkum. She will maybe wear a black or a sand or something, or they won't wear glass bangles. They may wear gold bangles now. Before, even that was not permitted, but now, okay, some kind of thing. But this is about external things, but there's also internal things. Like the person says, ஐயோ நாங்க வந்து அமங்கலமா இருக்கோம், குழந்தை ஒரு மங்களகரமான விஷயத்துக்கு போறீங்க, நான் இதுக்கு, right? So they have you know they have taken it in, they accept it. Or you see people who are dark, if you compliment them, say, hey, you're dressed so well today, you're looking so smart, what is the response? Hey, என்னங்க நான் உங்களை என்னங்க பண்ணேன், எங்க காலை வர்றீங்க, நான் என்னங்க பண்ணேன் உங்களை, what happened, நானே கண்ணுங்கறேன் இருக்கேன், என்ன போய் இப்படி சொல்றீங்களே. So they have taken it in so much, but society also has a big role to play, because if you travel from that side of Chennai, say Tandiyarpet or something, all the way to Tambaram and beyond, you will not probably, nowadays you might still, because the times are changing, no? Like I think it's Bob Dylan's song, right? The times they are changing. So they are changing, but very, very slowly, not as much as we would like it to. So you can see not one poster which advertises dresses and jewels and cars and whatnot, which we all use, but not a single ordinary looking person who's probably a little dark or dusky or brown or whatever. So that is so what they have inbuilt, intaken into their self, is also reinforced outside, because otherwise why are they not on the billboards, why are they not on the posters, right? So that's how it works. So this so the title that we said, it's a three-headed monster, like the Medusa, there's this 100 I don't know, her hair is all snakes coming out, right? Medusa. So, or Hydra, you can even call it a Hydra-headed thing. But since I was looking at these, yes, there are so many different components. We docketed them very for our convenience into just three. See, it's like ancient world divided the whole world into just 5 elements, right? Earth, water, fire, air, and sky, right? But modern science puts it as solid, liquid, and gas. So there are different ways. So like that you can have, and Mendeleev's table, I don't know how many, somebody in chemistry might tell us, like 200 and odd elements, right? So you can divide it any way which we want, but we can take the thing that is convenient. So for me, as a clinician, as someone who works in the community and in the clinic, I find this triune body, as you can call it, no? Like, also you have for example, even in religion, you have Trimurti, right? The Hindus have Trimurti, Brahma, Mahesh, Vishnu, right? Or the Christians have their triune, that is Father, Son, and the Holy Spirit. So this triple thing is always there. So in a practical sense, I've taken these things, because we have to do the body exists, the physical body exists, and it has certain issues that you have to deal with. The psychological body exists, and it has certain things that you have to do, and the social body, and the interconnections also lead, as we said, from one to the other, right? So it's all interconnected. So this is the thing. So mental problems is probably one of the currently very severe kind of a problem, because this is a avoidable preventable and treatable kind of a situation. And that is what we are worried about, because people are not able to see. For example, we become very jittery about even using the word mad or crazy, because we have used it in a negative connotation to tease someone, to taunt someone, to trouble someone. So even when we want to state it like that, we become very hesitant, right? So we need to reclaim the words so that we can use it in the proper way, and we teach people how to use those words. There's no shame or fear in that. So even things like sex, for example, so children in young school days, may fourth standard, fifth standard, it was the sex keh diya, but sex has so many meanings, and even intercourse is not a bad word as such. But remember, one of the most commonly used bad word, as they call it, is a 4-letter word, right? So the way we stigmatize words, we stigmatize areas. For example, if you have a mental health institute, for example, Kid Park, or in Bangalore it is Laksandra, or Hosur Road or something. So they call that whole area Huchaspatri, or either mental hospital area. So that is where the problem is. It's not about using the word, and again, wrong usage of mental. Mental is pertaining to, but pertaining to what? That you have to say. But in Indians, because they don't know English construction, so they don't understand that mental is a sort of a prefix to something else, right? Mental illness, mental well-being, a mental attitude, or whatever, so it's something, it indicates it's something to do with the mind. That's all. In itself, it is not negative. But imagine, in ordinary conversation, that word has become a problem word, right? In Tamil, they say, mental, so they don't say, are you in your senses? You can ask that, but you're using a wrong word in a wrong way. So that's what we need to recapture. So this three-headed monster, so this is happening. And in psychological terms, the major problem is that they avoid, even in leprosy for that matter. Actually, that's a very important thing. So as sir was saying, stigma is not only to do with mental illness. Yes, it is to do with all kinds of things. Anything that you label as undesirable, and then when you act on it, you behave accordingly and ill-treat someone, segregate someone, don't allow him opportunities, don't include him or her, right? So and use words in that picture. So it's a big chain kind of a thing. So leprosy. So leprosy is otherwise called the father of rehabilitation. Why? Because leprosy is something, everybody thinks leprosy na kai ipdi aidum, right? But not really. The leprosy bacteria doesn't eat away your hands or your legs or nose or whatever. So what happens? Does anybody know?
It's an autoimmune disease.
Not okay, you can say that, but what really happens? It's not like the hand just withers away through autoimmune thing, right? What really happens?
Actually, can I speak?
Yeah, please go ahead.
Actually, they don't get the sensations, so they tend to get burned and all, and that is how they do.
Exactly. So the bacteria only attacks the nerve. It doesn't attack your muscle or your skin. It doesn't. It's not like your staphylococcus or streptococcus or other things which give you pimples and boils and pus and all that. No, it only attacks your thing. And there is a stigma there. What? The pale colored discoloration on the skin, which initially will be very small, and that will be hypoanesthetic, as they say. You can't feel the sensation. Now that time, if you go to the doctor, done deal, nothing. You'll be all right. Of course, you need to take tablets for a longer time, according to the National Leprosy Control Program and all that. But it's clear, you're safe. But will people go? Will people go? No. Because stigma. Because they have probably they have also seen the end stage or last stage where the hands become like this and all that. And again, it's not really that the hand gets destroyed; it's all the muscle and contracture and all that. So the thing is, what was a primary impairment was in the nerve, but because we neglected it, that led to a secondary impairment, which led to a secondary, which led to another disability, which led to lot of other consequences. So from what was basically one small hypoanesthetic patch, just that in one small area, like a small wart or a mole, because you neglect it and you cover. If you remember, there are stories and movies where the person doesn't wear exposed, right? They don't take off their shirt or their blouse, or they, which is why I want to also add, we stigmatize beauty pageants and all that. Again, because we standardize things, right? But also because we have this moral thing. But in many ways, a beauty pageant can also be where people can be proud of their bodies, the way it is. Now it's changing again. See, now you have beauty pageants for middle-aged persons, for married people, for mothers, for people who have disabilities, right? Everybody. It's becoming, and even male beauty pageant, which couldn't have been thought of, right? Now we even have a male pageant also. Though not as popular or as much in demand as the female ones and all that, but yeah, we are kind of going there. So therefore, what happens? The small hypostatic thing led to, as she was saying, you're not aware of the small injuries. Like I'm walking now, or I might brush against the wall, and that will scrape my hand, but I'll immediately rub. All of us do that, right? But because of the lack of sensation, I will not take care of it, and it will keep getting injured. Tamil சொல்லுவாங்கல பட்ட இடத்திலே படும், பட்டுக்கிட்டே இருக்கும், பட்ட இடத்துல பட்டுட்டே இருக்கும். So because that is the extreme, right? Your hands are the extreme, your feet are the extreme. So they are the ones which are negotiating your space and course through the world. So that is the first place which will be attacked, or which has to bear the brunt. And if our normal nerve sensation protects us. So even as we come near an object, automatically, now I'm walking and I'm coming near the car, I immediately take, not only visually, but also in a physical sense, like you said, aura madri, I get something about the physical thing, something about the pressure. So I will keep my distance. Also, when I get hurt, then I learn, oh, I went too close there. So, but all that is lost. So repeated, recurrent injuries, and then you develop these loss of finger. But after that, what happens? There is something called dehabilitation. That is, within your habitat, within your house, you start sticking to the inner rooms. You don't come when guests come. You stay in the backyard. Slowly you stay in the outside in the street, right? And then you become a destitute. Of course, then you die, but not with dignity, right? Obviously on the streets, unclaimed and stuff. So to prevent all that is a long road from destitution to dying to like Nirmal Hridayam. So you have to rescue people from being on the road, right? Dying, and at least give them a dignified death. If nothing else, palliative care, terminal thing. So then if you can reclaim them, you can rehabilitate them, then you bring them back to society, you heal them. So that is why leprosy is called the father of rehabilitation. And so now a lot of stigma that was there for leprosy is gone. If you remember the Christian stories, Ben-Hur and Ten Commandments, so sin itself, you were punished with leprosy because you had sinned, that you hadn't followed some commandment and all that. But now that kind of stigma has gone, right? Now we have medicalized it a bit. So sometimes medicalizing a condition is also good. But again, it's about balance, right? do we have a balance? That is what is the thing. So suppose we over medicalize something, what happens? For example, grief, right? We over medicalize it. We make it totally something that you have to medicate it, that you have to do therapy. So you need to know where to call the limits. So this medicalization is a issue. On the other hand, because of stigma, we don't medicalize it, we don't externalize it, we don't share it. So that is a problem, and we lose out on so much of ability and possibility that is there in the person who has that particular stigma or that particular condition which you are stigmatizing, and based on which you're discriminating and differentiating and telling them to this thing. So how do we begin to heal? So just like the monster has three heads, the body has these three components, the intervention also has to be like that. So which means it has to be very nuanced. You have to be present to all the aspects there. So one of the basic things, of course, is education, both a general education and mental health education, mental health education, but also about emotional education. So that is something we don't have. That is why sex is stigmatized, sexuality is stigmatized, looks are stigmatized, relationships are stigmatized. For example, if you're staying with someone without marrying, then you're stigmatized. You won't get certain benefits. You will not be invited to parties. You will not be called for this, that, right? And of course, if you're widowed, you've been properly married, but the guy popped it. So no, you can't come for things, So these kind of things. So we need to educate and discuss, but also emotional intelligence, emotional skill building has to be there. And this is about so many things, not about. So that is why we need to look at it. Where is the stigma coming from, or is it a composite of, say, physical and psychological, or psychological and social, right? So when you look at widowhood, it's probably purely social, religious for that matter. When it is caste, it's probably social, but a little bit of other things also. So there are different things in which it comes, but the basic thing is education and conversations and inclusivity. So where we kind of represent interaction, where we invite interactions from everybody. So all the stakeholders. If you see in a village, in a community, if you go, they will not ask women per se. Then if they are widowed, even less, right? Or if they have some kind of disability, even less, right? Then they may not call in children, they may not call someone who's got mental illnesses. So getting this kind of a culture that all of us have to join together, whatever the condition, whatever the thing. If you remember in COVID, a lot of people started justifying casteism. So, பத்தியா இதுக்கு தான் நாங்க அப்பெல்லாம் சொல்லிட்டு இருந்தோம், தள்ளியே இருக்கணும். What a way to look at it, right? So justifying something that was patently wrong, and you take it like this. So if you do not share, if you do not externalize, so just look at, if you've not told about your scar, I mean your hypopigmented patch, it kind of grows and grows and grows and leads you up to that. So what leads you to that tertiary level of disability and destitution or even death is this, that plain ignorance and the stigma, and both feed into each other. Because there is stigma, we do not broach these subjects. We do not talk about HIV, we do not talk about sexually transmitted diseases, we do not talk about teenage pregnancy, we do not talk about sometimes also it's a shub shub bolo na, don't talk about, there's this thing, oh, don't talk about negative things, as if you don't talk about problems or they will not happen. Okay, of course you need not dwell on it. There is a idam poru level when what you have to speak, but the way we have made it is that you just cannot and should not talk about these things. So when there is no conversation about it, then how do we have the right kind of conversation? How do parents broach subjects like growing up, about feeling a crush, or any kind of, even see, there are children, small children who have a boil on their penis or their on their vulva or something. They're not able to tell the parents because it's such a shameful place. They probably wish it didn't happen, and they probably wish that it will disappear on its own. But it's not going to. And suppose it's something serious, so it is. This is what we need to open up about. So I think I'll wind up here, and yeah. So I hope I've covered the thing basically. This is of course such a huge topic, and so many we can talk about it from so many angles. So looking to you for what all of you to give me some kind of
Admirably said, Anbu sir. Thank you so much for that. Just to wrap it up, first of all, stigma is real. I think we can all agree on that. And then it manifests in behavior. That's something which we also know about and which was pointed out. The prejudice or bias we have reflects in our behavior. The thing about education struck home, both mental, all three, mental, emotional, and social. I think we should just get there and get there to that space tomorrow, which was aptly called that the next type of stigma would be aspirational, where we look down and we have a comparative keeping up with the Joneses kind of thing. So it is an extensively documented, but inclusiveness is the way forward. And I think that given what doctor said, education is the key. And I think if we can spread the word that mental health and mental ability is not the same thing, they are ability can exist in many forms. And so, have I capped this up well, Anbu sir?
Yeah. Which reminds me that I did not emphasize enough about the role of art. We haven't used art enough, of all kinds of art, whether it's writing, whether it's painting, whether it's sketching, sculptures, collage, public installations, performance arts, drama. These have to be used much more, because more than a lecture like what I did or this discussion we had, that kind of thing. So there are things like theater of the oppressed, right? Playback theater, expressive arts therapy, open dialogue, these kind of things. And politically speaking, I would like to emphasize on street parliament and child parliament, and of course life skills training. So these are things way forward for all of us together, become more well-rounded people who can connect with people in a balanced and healthy way and avoid hurting anybody unnecessarily. And so we can work with everybody. Imagine if Father Damien hadn't worked. Today we have a Damien Foundation. So when he goes, leprosy, people who suffered from leprosy were called lepers. Imagine, so that is an important discrimination, right? I have leprosy is different from I am a leper. I have diabetes is different from I'm a diabetic patient. I suffer from schizophrenia, or I suffer from something that doctors call is different from I am schizophrenic. So this usage of these kind of public methodology, it's in a kind of a more easy way of tackling this very hydra-headed monster, three-headed monster, whatever you want to call it. The multi-pronged approach is really these things that should be emphasized, and someday we can talk about these things and how they can be used in public spaces.
Thank you so much for your time, Dr. Anbu. Thank you everyone for joining us today. As Manjari has posted in the chat box, we do have an English support group which meets every Wednesday at 7. Another way to get people to talk about it, to start the conversation and carry it on